We'll get started with the roll call. Right?
Roll call. Councilmember King.
Here.
Councilmember Moreno. Councilmember Jeruso.
Here.
Councilmember Morel. And Councilmember Harris. We do not have a quorum.
All right, thank you. Thank you. Today was April 24th, the Quality of Life meeting. We just jump into the agenda number 3. Number 2, we don't have a quorum to approve the minutes from last meeting, so we'll just jump into agenda item number 3, discussion from the city. Right, about the different contracts from Katy Ambulance and.
Yes,
Well-
since we don't have a quorum, we'll just hear the presentations.
Do the presentation. But first we'll jump into number 4. I'm sorry, number 5, presentation from Office of Youth and Families. We'll do that first.
Good morning, Council. In starting this presentation, I do just want to say that we are going to be building off of the monthly reports that Jen has been sending. So it might just sound like a reiteration of what you've already read, but we want to make sure that we went through everything because we know community is listening and we want them to have a better idea of what the work has been. So if you have any questions, obviously just let us know, but it's probably a lot of information you're familiar with.
Thank you.
With that being said, I do want to go ahead and introduce Dr. Fillmore and then Jen Roberts from Agenda for Children, and then also Nola PS, who will be a part of this conversation. So some quick background on this. On April 30th, 2022, we approved the 20-year millage, which is going to be using property taxes to support funding early child education here in the city of New Orleans. A couple of things to keep in mind about this. The 3 of us are sitting in this space because the CEA is between OYF representing the city, NOLA PS, and also Agenda for Children. Just a quick point of reference, we started collecting money with tax revenue starting in January of 2023. And so far we're at $20.9 million collected. We pulled that data as of the 19th. And then our role specifically, the city, OIF, we are just managing that CEA. So I am not the expert on either one of these topics today, but I'm smart enough to bring those who are, which is why you have Jen and Dr. Fillmore. With that being said, I'm going to go ahead and turn it over to Jen.
Hi, good to see you both. So again, some of this might be a little redundant given our monthly reports, but just in the issue of transparency, want to make sure that we are communicating per our quarterly updates. So as you know, there was a fairly historic millage that was passed, and this is in an effort to ensure that the number of children in our community who are currently eligible for the City Seats program can have more of an equitable access to it. So right now, this is data, this is the most recent data that was collected as of October 2022, which will show that we have around 11,500 children in the community who are economically disadvantaged, who would be eligible for subsidized education at the early care and education level, so ages 0 through 4. And right now, about 2,500 of them, which is about 22% of them, are being served, leaving just under 80% of children right now who are not being served. So this millage was designed and will continue to be implemented in an effort to serve as many children as possible. You might recall that when the election happened in April of last year, this was to pursue a school year program that would begin in summer of 2023. And so the school year will actually begin July 1st, 2023. We are still in the current school year right now, which is related to a CEA that ended in December 2022. As part of this, we have been building infrastructure that is specific to ensuring that that school year and the millage itself are successful for the first 5 years. And that is really focused on 5 priorities. When I came for the budget hearing in November, these were mentioned, but I do want to just stress for you that they include workforce. So how do we ensure that we have the number of teachers available and educators who can work in these classrooms? How do we ensure that we have operators for early care and education programs that are quality and that can transparently and accountably utilize these dollars and do so in a way that ensures that children are receiving the highest quality education? Also working with NOLA PS to ensure that families can access these seats in a transparent way. How do we ensure that families, teachers, and students who are participating in the program also receive those necessary wraparound supports, which have been found to be one of the hallmark parts of our program? And then lastly, how do we ensure that as this is a new millage and a new funding source for our community, that it is appropriately communicated on so that both taxpayers, the council, and the city are all aware of what's happening? So just a quick recap, you know that this has grown fairly rapidly, and you could just straight down to 2023. We know that we'll be serving 1,000 students based on the city millage funding. We have since then received an additional source of funding from the state, which will serve 53 additional children through a bridge fund through the end of next school year. And then we are still waiting to determine how much money we will receive in state matching funds. And I'll talk about that in just a bit. So just to give you a little bit of context, in October, we ran the citywide coordinated funding request, something for all publicly funded seats. 55 childcare centers applied for these seats, including B2 seats, which is a state funding that we have typically used to blend with our city funding. So it runs the same program. And they requested over 2,000 seats between those two programs. We scored those applications through December and January. That included both a written rubric as well as a site visit to every single one of those programs. And then in January, the Noeen Steering Committee, in compliance with Louisiana Public Meeting Law, did vote on those recommendations. Those recommendations were posted in advance as well as deliberated in a public meeting that was also live streamed. 21 seats of those 978 were not allocated. So we basically took 978 seats and allocated them to 42 programs for next year. And the reason why we didn't allocate all 1,000 is that between now and the end of the current school year, you're going to have children who are going to enter the program who may age up and who may actually need a seat. And so we need to reserve some seats for students just in case. If for whatever reason we do not need those seats, we'll reallocate those to existing providers. And then once House Bill 1 has been finalized and the governor's budget is approved, we will also then know how much state matching funds we will receive. And then we'll put those into the allocation mix this year. So here you have the general breakdown of where the current 1,000 seats are currently allocated. We know these numbers will go up with the state match, but this is where the current 979 seats are. Just to jump straight to it, Councilmember Giarrusso, the reason why you have one is that you actually don't have a ton of centers right now that are eligible. And so we'll be working with your centers to help raise some of their quality and also working with our early Head Start providers in those spaces to kind of provide them a training ground so that they can actually increase. You also don't have as many childcare centers in your district as some of the others do. So this is for information. You have it here in your presentation. So just so you can see what centers in your districts have been provided seats for next year. And then there's also different elements of the CEA. And so now I'm going to spend the next 3 slides just talking briefly about that. So one of the sections is around comprehensive wraparound supports. So these are supports that are provided to these students, families, and teachers participating in the program. What we did was we actually worked with our national expert to actually assess the current suite of wraparound supports to determine whether or not those were the most effective use of those funds, and then determine from our providers and our families and teachers where we needed to either bolster funds or perhaps scale back some of those services. And what we have found is that next year's model will include an increased professional development for caregivers, health screenings, mental health consultations, attendance counseling, nursing, and early intervention services. So actually bringing medical services onto the childcare sites. We anticipate partnering with Agenda for Children, Children's Hospital, Tulane University, both the School of Social Work, as well as the Childhood Mental Health Consultation Team, TICE, Training Grounds, among a couple of other partners. We plan to finalize these contracts in May, and they will actually go into effect beginning in July with the school year. We've also worked with, as you know, in the CEA, there's a kind of a remaining amount goes towards building capacity in the first 5 years. And that is to build the necessary infrastructure for folks to be able to actually increase quality and increase our workforce in this space, as well as increase the number of facilities in the space. And so what we did was, beginning in summer of 2022, we actually developed multiple design teams to work on both of those issues. Through that, we created a workforce task force that was comprised of about 30 community organizations to come up with something we call the playbook, which actually articulates 3-month, 6-month, and multi-year strategies to increase the number of individuals entering into the early care and education workforce. In addition, we raised private money to be able to pilot something we're calling the facilities workforce pilot, to be able to figure out how to test actually providing some funding to our childcare centers directly for modification, down payment assistance, mortgage payoff, small renovation projects. So be able to figure out how can we actually increase capacity within the sector and field. And we made about 22 grants totaling about $500,000 there. Going forward, depending on the total amount of revenue collected from the tax, about 40% of that will go towards facilities and about 60% will go to workforce. So right now, the budget itself that was both approved by the Noeen Steering Committee as well as the Mayor's Office includes down payment and mortgage payments assistance, a child care emergency facilities fund. So if something breaks, which actually can close down a child care facility for some time, being able to get in there and get that fixed and repaired quickly. Facility expansion grants, zoning and permitting support. So both at the city level and the state level to ensure that we can get the fire marshal out there and get folks up and running faster, as well as non-traditional play spaces. So not just folks that are operating in childcare centers, but we know that there are a number of nonprofits and public sector partners that would love to be able to facilitate high quality early care in their, for example, courtrooms or in the library system. So we'll actually be able to partner with some of our non-childcare partners to provide some additional spaces for children. And then we also have about 60% of those funds reserved for workforce supports. And that includes both a universal job board, working alongside around recruiting, retention efforts, compensation efforts, et cetera. And then as part of this, you know that there is an annual evaluation that is required, and that RFP has been written and will be released this month. And it is our intention that we'll have that person selected no later than June. The budget has not been amended in any way since the budget was approved in November. And as of right now, no funds have been expended because they are restricted. And so they will not be spent until July 1st. I'm going to turn it over to Nola PS.
All right, good morning. So 3 areas that we'll talk about today include our early childhood coordinated enrollment and campaign updates. We'll talk a little bit about our seat allocation process and where that's going, and provide an update on our finances. So to meet our goal of enrolling up to 1,000 seats, we've been working collaboratively with Agenda for Children and the Office of Youth and Families in 4 important areas. The first is to create a coordinated enrollment plan. We've been able to do that with emphasis on community awareness, coordinated eligibility, and to ensure that we can maximize our system capacity. We've also worked to increase family access to early learning opportunities. Our new application platform, Avela, allows for families to apply in a one-stop shop. We also hired a marketing firm to support us with the campaign. You may have seen billboards everywhere, our social media work, the development of a website, Enroll NOLA PS. to ensure that families have multiple points of entry into our system. And we hired 3 additional bilingual EC family enrollment specialists to support our enrollment work. Additional things that have happened through this partnership, we've also partnered with Cities Families Connect. This initiative is for new parents to increase family access and awareness for all eligible seats. We've been doing our research. We've been focusing on data simulation, so we have an idea of how we can increase equity, what are some of our areas for improvement. And through that work, we've been able to improve our match process. We've also been able to support evaluation processes that helps us to determine which centers receive publicly funded seats and how many seats are allocated each year. So those have been 2 important areas for improvement in our district's work. We've also worked to improve our student information system, Salesforce, with Attain Partners. We've been pursuing early childhood enrollment and effective engagement strategies through a collaborative effort with New Orleans Collaborative for Early Childhood Research and Brookings. And last but not least, we've been installing tech stations in our family resource centers so that families can have support when they go into our FRCs with the application in person, when needed, so that if they have challenges from home, they have somebody in the center who can support them while they are enrolling. Our enrollment update's been pretty exciting. We have over 4,000 families who have applied. That's up from 3,600 applicants from the previous year. Our main round has already occurred, and we just reopened our application round since we went down briefly for some updates, and now it is open again. But you can see the breakdown of main round applicants by age group from infants to 3-year-old applicants. And you can also note the city seat allocations over to your right. A couple of things that we are continuing to do to support enrollment. One, we did hold over 20 family and program partner enrollment support sessions. This work is continuing in this next round, and we are offering these sessions in both English and Spanish. We did survey our applicants just to see how they feel about the new system, and over 70% of families describe the application process as excellent or very good. But it's also important to note that less than 5% of families described it as difficult to use. And some of the things that they noted about using the system may be like the font is too light, for people to see. So these are improvements that we can easily make so that it's more user-friendly for our families. And we also open up again in April 19th for families who did not apply during the first round, so they'll have the opportunity to do that again. And here is a breakdown of the budget that was approved in November 2022. Jen did briefly go through the breakdown of the budget, but we wanted to note that the majority of our dollars thus far have been spent on the budget campaign, people in our family resource centers to support families, and on our enrollment website and application process. We have provided a more detailed budget to Jack in the mayor's office that gives a little bit more of the line items underneath each of those categories, so that information has been shared. We do want to note that in the first year, the budget is $2 million. However, the following years will be $1.5 million in terms of the allocation. And we are prepared to make those adjustments as needed so that we can stay within the budget. We did make several one-time expenses in this first year that are non-reoccurring, such as the amount that we spent on campaigns to get everyone enrolled, the dollars that went into updating our systems that cost less moving on in the preceding years. So we are prepared for those adjustments in the next iteration of our budget. So with that, we will take your questions.
Well, I want to thank you for your presentation. I'm
Mhm.
excited to see money going towards early childhood, going towards our children. We say that a lot. Need to invest in our youth, invest in our children. Often that's just said, but we actually see things being done over 1,000 slots being filled by children in the city. May not see results
Mhm.
tomorrow. This is more of a long-term plan. So I'm excited and glad that you all are working with us to make this happen. Thank you. Councilman Jeruso?
Yeah, good morning, everybody. Good to see you. My only question is, Jen, of course, you mentioned that there's more applicants than seats. In case people cancel, age out, don't do anything properly, something happens, is it a first come, first served system waiting list? How does that work in order for people who are in the queue?
So all 42 seats, and Dr. Fulmer, you're happy to jump in as well, but all 42 seats actually have wait lists. And so one of the things that happens now is that goes to the next person on the wait list.
Okay. Well, look, I agree with Councilmember King. Even though District A has the fewest number of children, I'm excited to see what these numbers look like. This is a gigantic step forward. I think, where's the slide that shows in 2018, we had 50 kids. And by 2023, we're anticipating 1,000. And that's significant change. And so I appreciate all the work that you do and know that we need even more money to be poured into this effort, and that this is a down payment on what needs to be done. But if we're going to keep on talking about root causes and addressing those when it comes to our kids, this is absolutely one of the places we have to start. So thank you all very much for all of your work.
Thank you.
All right. Thank y'all for the presentation.
Yeah, I just wanted to add, I sat in council last week and the women of Delta Sigma Theta came and they were speaking directly about early childcare and the millage. And so whenever people do come into the space, feel free to default to us as a support for following up with people or whatever the case may be. I know that y'all have people constantly coming in with a variety of topics. So if we can better support in that way, just shoot an email, text, call, and then we'll make sure that we follow up with those people.
Thank you, Ms. Anita. Any online comments? Well, as far as the last week, I didn't know we didn't know that they could present.
Oh, no. Whenever it comes up, no pressure.
I know that's your sorrow, so you can next time.
Oh, they will be here. Don't worry. Alpha Kappa Alpha is the only way. Thank you.
The only way,
Just-
I'll add,
Just a little
The
tea.
only way.
the only way.
Oh, okay. Well, thank y'all. Thank y'all for the presentation. Thank you. I appreciate it. Up next, we'll have the mayor's office. Is that correct? No. Professional service, Acadian Services, Acadiana Services. We're not gonna vote on these, just have discussion if needed. I don't know. Maybe Councilman Jeruso may have, or Councilman Harris may have some questions.
I guess, I mean, we got these on Friday. I'm just not ready to vote yet. I mean, well, I want information. I mean, that's what I'm asking for is, I'm going to say this for like the 10th time, which is if you want us to vote on things, we need to know in advance. We are getting ready to pass rules for the council ourselves about how we do things, so we don't devolve. And I think I speak for at least myself and many of others of us about if there are contracts that you want us to vote on. Yes. Yeah, I understand, but nobody met with us about it. So I am willing to use funds for things, but it needs to be explained in advance. So I understand people are here, but my point is we can't keep on going down this path repeatedly where we get into council chambers and we're hearing about things for the first time. It is unacceptable and it is not good process and is not good practice. We need to get to be able to see these instruments, be able to read them, be able to ask our questions in advance and understand what's going on. This is the appropriating body. We are the appropriating body. Therefore, we are entitled to have this information before it comes to committee meetings. I'm tired of asking for this repeatedly. So what I'm going to say is this. I'm going to start holding up stuff at budget committee. if we can't get this done correctly and there can't be a good process in place, then we'll just have to hold things up until every single council member has had a conversation where they feel comfortable and they know the information that we're seeking. All right. Anybody else?
So, Mr. Torrey, anybody wants to present? Is Acadian going to present? So Acadian, I guess after Mr. Torrey, you're more than welcome to come. I was told that you were properly notified, you're here. So after that, you could come and speak if you care to do so. Mr. Torrey, the floor is yours.
Hey, good morning, council members. I'm just here to speak to the 4 amendments regarding the city's emergency debris contract. So we have 3 emergency debris removal contracts with Ceres Environmental, 1 debris monitoring contract with Witt O'Brien's. These contracts were procured in 2021. They have annual renewals based on extensions. So the city is just seeking to execute those amendments in preparation for the 2023 hurricane season. We did activate these contracts after Hurricane Ida, obviously, with Ceres and Witt performing valuable debris removal functions. And we are simply going through our extension process to have these contracts in place and pre-positioned for in advance of the 2023 hurricane season. So
what is the total amount?
the total amount, each of the debris removal contracts, so there's 3 zones for the city. The value of those contracts is $4 million each. So about $13 million for those. The debris monitoring contract value is $6 million. Yeah, we spent, and just to give you some context, for Ida, we spent about $7 million in debris removal services and almost $3 million in debris monitoring services.
What does that mean? I don't know what debris monitoring means.
Debris monitoring, so Witt O'Brien's is the company that provides debris monitoring. So they actually are the group that monitors the debris removals to make sure that all debris removal is happening in accordance with FEMA regulations to facilitate reimbursement by FEMA or GOSEP for the city. So they actually have the monitors that are with every crew, tracking, photographing, making sure that what they're doing is within the regulations of FEMA to ensure that the city gets fully reimbursed for those activities.
And does this come into play only if there's an emergency, or are we just paying like $6 million annually for this, even if there's no disaster?
These are pre-positioned contracts. So that's the value of the contract, but they only activate it upon emergency and then billed for services rendered.
Okay, thank you.
Mr. Torrey, is this from the general fund?
Yes, these would come from the general fund.
All right, and is this already been allocated for the budget this year?
No, these are pre-position contracts, so they're not allocated. They're only funded should a declaration happen, and these services are activated via work orders.
And then it also looks like the amendments go through 2024. Is that right?
Correct. 1
Okay.
year.
And I like the idea of making sure we're prepared for that point. The only question I have about that is it ends in like July 2024. So would we want to extend it through the end of hurricane season, or is there a reason contractually we can't do that?
It's just the way the contracts fell based on the original procurement and execution. So that's why we're here now, to make sure that it's extended ahead of this hurricane season. We'll be back next year because the debris contracts had 3 1-year extensions. So we'll be back next spring again to facilitate that last extension for the debris removal contracts. And then we'll do a new procurement once we've fully utilized the 3 available extensions. So unfortunately, just based on when we do procurements, they fall at unfortunately sometimes inopportune renewal times. So we just
Okay.
have to make sure that we do our part to be here early to make sure the renewal's in place.
Is there a way I mean, and this is a question from ignorance. Is there a way we can fix that in the procuring process?
Mm.
Because it just seems like rather than having to worry about in the spring for the year before, that we just want to extend this all the way through whatever the next season's hurricane.
Absolutely.
Seasons.
We just happened to do that procurement in March of 2021, which meant when it got signed, it put us on that cadence. But yeah, so we would want to do the next procurement probably at the end, the fall or the winter, of 2024 to make sure that we're out of that summer cadence, as you allude to.
Okay, thank you.
Mr. Torrey, can you tell us the locations for the debris, where the debris will be stored or moved to, different parts of the city?
Sure. So the city has multiple debris management sites. So these are permitted sites through the Louisiana Department of Environmental Quality. We have sites on Old Gentilly Road, the former incinerator site there. We have a site at Hendy at the former incinerator site there. We have a permitted site at the Legion Fields sanitation yard. We have a permitted site at the Recovery One landfill. We have a permitted site at the Gentilly landfill. And our most recent addition is a new site at the Parks and Parkways facility in Gentilly.
All right, any other questions, Mr. Torrey? All right, so we're not gonna vote on this here. Let's go to the full council.
Sure. Well, I certainly appreciate, your support and any questions you might have, after this meeting, feel free to reach out. I'll be happy to provide information.
Thank you.
Thank you.
Thank you all.
Any other presenters?
Excuse me, Acadian Ambulance. Did you want to come up?
Okay, yeah, so this contract is with, between New Orleans EMS and Acadian Ambulance for, surge ambulance services. And so we've had this contract with Acadian since 2020 during the emergency declaration. That was you made a motion to, approve the extension. I believe it was last month for us to close out that contract for 2022. This is the 2023 contract that the RFP was from December of last year. And so we placed the RFP out for those services. Acadian was the only respondent to the RFP. And they were awarded the contract in December, starting January 1st for this year. And so basically that is they will provide us, just as they are now, with those staffed ambulances on a daily basis to support 911 emergency response. That's anywhere from 5, normally it's 3 to 5 trucks a day. And then we're able to surge up for special events, disasters, things like that. And so we have $2 million allocated in the budget under general funds to accommodate that contract.
I don't think we have a contract up here. Any you don't, is there a copy? Copy of the
Yeah,
contract?
it was Sarah and y'all, we have a copy.
We don't have copies. All right. No, I don't know if it's necessary. We're not gonna vote on it here. Ms. Anita? I don't know if they. All right, so after discussion with our legal team, we'll just wait until the full council meeting to bring this for the entire council. And we're going to defer item number 4. The council president Morel isn't here. But I think we have a quorum now. Ms. Nita said we'll do a roll call again and approve the minutes from last meeting and then adjourn this meeting. I'll do the roll call. Freddie King present, Councilman Druso present, Councilman Harris present, Councilmember Morel, Councilmember Moreno. We have 3 present. We do have a quorum. At this time, make a motion to approve the minutes from last meeting. It's properly second by Councilmember Druso. All in favor, say aye. 3 ayes, no nays. Minutes from last meeting are approved. I make a motion to adjourn. Properly sent by Councilmember Harris. All in favor, 3 ayes, no nays, meeting is adjourned. Thank you.